That's exactly correct in the approach she took, which allowed her body to adapt to the nutritional supplementation, which resulted in her diabetes going into remission.
Again, so this goes back to what Dr. Gershon, Dr. Day, and Dr. Fred Eichhorn have said about balancing yourself nutritionally. And it also appears that the flax oil and kefir select and the Vitalzyme enzymes allowed her body the nutritional supplementation to put her diabetes into remission, even without the additional supplementation.
I would agree with you on that, but it appears the use of the additional nutritional supplementation was some very good insurance in making sure she got the diabetes into remission. Melissa did a great job. I'd like to point out something else here that I think is very interesting. I had the chance to visit with Melissa on several occasions as I'm friends with her husband's brother. Melissa seemed to have it beaten into her head that her blood sugar should be running about 100, according to her doctors, but her blood sugars were fluctuating all over the charts, running from 140 to 200 after she got out of the hospital. She indicated she never seemed to get it under control, but her goal was to get it to 100. I told Melissa she might find this very interesting, that about 15 years ago the blood sugars were established at 140. Then, several years later, they dropped the blood sugar levels to 130, and then to 120, and now all of a sudden it's 100. I told her, what's it going to be next? 75? I told her I personally believe someone's playing games with these numbers, and they don't appear to me to be realistic in many, many of these cases.
That's a very interesting observation. I think that you've pointed out something that I've never thought about before. It appears to me, by what you've said, a person would follow the money on why the blood sugar numbers were set artificially low. I would also assume the pharmaceutical companies are the ones that set the blood sugar levels so that they can make the pills and the insulin. So, in other words, who would gain from this monetarily by keeping people on the insulin or the pills unnecessarily? And the only ones that would gain from this, in my opinion, are the pharmaceutical companies. Then when you think about all the other companies which make products for diabetic patients, there's a lot of big money involved here.
I think personally you're right on track. Many people that I've spoken with in the past who have diabetes indicated to me they felt the proper blood sugar levels should be around 120, which I believe may be a little low. When you look at Melissa's case, she leveled out at 126. And I've seen some others where the blood sugars were leveling out between 126 to 130, maybe a little over. I definitely believe these blood sugar levels have been set artificially low, but just my opinion through observation and talking with many people, getting their opinion on this as well.
Okay, so when people are watching television daily with all the advertising by the drug companies, people are led to believe that when you have diabetes, you just have to manage the disease with the drugs, and that's going to be a lifelong condition. I mean, I guess that may be true in type 1 diabetes, but not type 2, as it's very clear that type 2 is a diet and lifestyle related, such as Melissa had. This really makes me think about how badly our medical system is broken in treating these diseases. Because all they want to do is treat the symptoms and not the underlying cause of the disease, and that's just keeping the money coming in.
Well, that's what they'd like you to believe. But again, we saw with Melissa how effective the protocol was in allowing her body to heal itself once she had the correct nutritional supplementation. Then you really have to start asking some questions of what's really going on in the medical system.
Mike, so you mentioned another very interesting case of diabetes when we were talking about this earlier. Could you tell us just a little bit more about this case?
That would be the case of Richard. Now, Richard's got a great personality, and he would get me laughing every time he came by the office. In fact, I was recording my CD, and he knew I was going into the recording studio many years ago that evening as I was going to record the diabetes case of Melissa, which I had her permission in the original series. Richard came by my office at the last minute and said he wanted his story told of his health issues and his battle with diabetes. He stopped in right before I was leaving and gave me some very specific detail in regards to his case and asked that I share his story as well. I told him I would, and it's a very interesting story. Now, what's so interesting about it is that Richard had met Melissa and had used basically the same protocol for his severe diabetes as Melissa did after she told him her story. There were a couple of things he did differently than Melissa, And I'll explain that in a few minutes, as I believe it to be very important additional information. Now, Richard said from 1995 until 2009, he tracked his cholesterol yearly, and it was running from 280 to 290. During the same period of time, his triglycerides were running about 500. Richard said all medications, emphasizing if they made it, he had tried it with no results. So it kind of cracked me up when he was telling me this, as it was just the way he said things. Richard said within 6 weeks of doing the Select Budwig protocol, as Melissa had done, with a slight variation, his cholesterol had dropped from 280, 290 down to 169. He said his triglycerides dropped from 500 down to 189 after all these years of being out of balance.
Well, that just confirms what Dr. Day had said, that it wasn't a lack of a drug, but proper nutritional supplementation.
Exactly. And Richard went on to say that he was diagnosed with diabetes in 2000. And again, they even tried all the medications on him for diabetes at that time, but with no effect. So they finally put him on insulin. Back then, he said, he was put on Lantus, which he said was a slow-release insulin of 100 units per day, and put on Novolog, which is a fast-acting insulin of 20 units at each meal. He said the doctors also had him on 40 milligrams of Actos. Now, a point of interest here. Richard said the doctors in 2009 wanted to put him on an insulin pump, but he refused and said once he started on the Select Budwig protocol, it helped him with his insulin resistance in about 2 weeks. He said he then started backing off the Novolog, the fast-acting insulin, and was off of that in about 4 weeks. So according to Richard, he was able to wean himself off all the diabetic medication in a 6-week period.
Wow, that's amazing. He was able to pull this off in such a short period of time.
Something that I think is very interesting with Richard is that what took Melissa 3 to 4 months to accomplish, even though she was roughly off 75% of her diabetic medication in 3 weeks, it took him around 6 weeks, and he was off of everything. What I see as a difference here through observation and the information Richard provided is that Richard doubled up on the flax oil and kefir. Melissa was taking about 6 ounces of the kefir and 2 tablespoons of the flax oil mixed in and doing this twice a day, which would be 4 tablespoons of oil, which she would be consuming per day. Now, Richard built himself up to taking 8 tablespoons of the oil per day, using enough kefir to properly break down the flax oil. So in essence, he was consuming twice as much of the flax oil in the kefir as Melissa. The other difference with Richard, in my opinion, he was working out in the gym daily with the different weight machines, and this appears to be a major key. Melissa, not having access to a gym, in my opinion, put her at a big disadvantage. This is what I believe was the difference in the amount of time they were able to get off all their diabetic medications. In both cases, the blood sugars fluctuated when they were coming off, but then just went down to normal once the body was able to adjust itself. So those blood sugars can jump and then come back and jump and come back. So one just needs to hang in there from what Melissa and Richard were saying till it starts coming down and leveling itself off.
That makes sense. Okay, so why do you believe by increasing the flax oil, it works so much faster for Richard?
I think you have to look at the insulin resistance and how the insulin receptors on the cell membrane cannot take in the insulin produced by the pancreas due to the ingestion of wrong fats into the cell membrane. And we talked about that. It now appears pretty easy to overcome when you use the proper nutritional balance that Melissa and Richard used. You know, we talked before about the cells and how they fire between, minus 70 to minus 90 millivolts DC, and how the voltage drops in the cells when you consume the wrong fats, and how the good fats bring the voltage back up. In Dan's case, we just talked about, was a perfect example of that. I already mentioned what fats to stay away from as they plug up the cell membrane and lower the voltage in the cells. In turn, it appears to me the cell's insulin receptors in the cell membrane cannot function properly in picking up the insulin produced as they're being plugged up with bad fats.
Like peanut butter, right?
Good one.
So there is the insulin resistance we hear everyone talking about in the type 2 diabetic cases.
Exactly. Now, I might not be exactly right in my interpretation of this, but that's how I see this issue. And look what happened in both of these very severe diabetic cases I just talked about. In Richard's case, when he increased the electron-rich flax oil using twice as much as Melissa, he saturated the cell membranes, which in turn raised the voltage in the cells, making it much easier for the insulin receptors to pick up the insulin produced by the pancreas. Another point of interest here, when I was talking with Dr. Fred Eichhorn, he said the pancreas becomes very lazy when a person's on insulin. But when you rebalance the body properly, the pancreas should, in most cases, start producing the proper amount of insulin. Fred said he's also seen this happen with a few type 1 diabetes cases.
Have you heard of anyone trying this with a type 1 diabetes?
No, I haven't. I personally think the type 1 cases, they've had this since childhood, and in most cases would be set in what they're doing day to day. I haven't heard of any of them giving this a try. It would sure be interesting to hear about some type 1 cases actually stepping out of the box and give it a try.
Well, you know, people kind of hit a comfort zone and probably just stay in it.
I'd agree with that. I believe that a combination of systemic and digestive enzymes would be a very big player in type 1 diabetes. It would definitely help in the removal of any scar tissue in the pancreas, especially with the systemic enzymes in play, allowing it to try and start working properly again when you try to jumpstart the pancreas with this nutritional protocol. So I think this is exactly what happened with Richard and in the case of Melissa. I'm also aware of several other cases of type 2 diabetes since Richard and Melissa. In every case they told me about using this protocol, it worked the same. I've never seen anything like this with the speed the body recovers in using this protocol. It's just working beautifully for type 2 diabetics in the cases I've heard from. There are no guarantees though, but well worth giving it a try and see if it'll help you.
You know, Mike, this is some great information, and I feel like it's going to help a lot of people.